Could vaginal dilators help me with my pelvic pain? Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. So I want to answer this. Yes, in short, they may be able to help you with your pelvic pain. So I want to talk first about what are vaginal dilators and how do they work, and then I want to go into this a little bit more when it comes to pelvic pain. So here I have a set of vaginal dilators, and yes, I know they look a lot like sex toys. They are not. They're therapeutic dilators to help with pelvic floor dysfunction. They were developed by a pelvic floor physical therapist to help patients, help people at home be able to take care of themselves. And I want to show you just a little bit about what they look like and how they're used. I personally, here at the Healing Spot, like to use Intimate Rose products because they are nice and flexible. They're made out of silicone. So not all dilators are made of the same material or have the same options. So I'm going to specifically talk about Intimate Rose dilators. So here we have, you can see how they're graduated or gradually go from smaller to larger, and there's 8 different sizes. So how do these work? Basically, they can be inserted into the vaginal opening, and they can help to release the tissue around the entrance or the introitus of the vaginal area. And also they can be angled into the pelvic floor muscles to help into those deeper spots. So for a lot of women that I treat anyway, they can have pain right at the entrance. So pain with initial vaginal penetration, or it may even be pain with deeper insertion, deeper thrusting, or it might even be positional. Now, I know not all pelvic pain happens during intercourse. I know sometimes people have pelvic pain even just sitting, and there can be a lot of reasons for that, which I'm not going to dive into in this video. But I just wanted to cover the vaginal dilators. So here I have a female pelvis, and she's kind of fallen apart a little bit. Her magnets aren't quite working super well anymore. I'm going to go ahead and take this off, but if you can imagine, just here in the front, we have the vaginal opening, okay, and I'm going to take the organs out, and I'm going to take this off just so that I have a space here that's open that I'm able to show you how these dilators work. So ideally, you'd want to use a water-based lubricant. Let's go first with the size 1 dilator and kind of demonstrate that. So ideally, you would want to know what size are you needing to start out with. And this is where a pelvic floor physical therapist may be able to help you out. But we're going to take the smallest one here. Imagine that you can then insert it into the vaginal opening, and I use my hand with this, I think. So imagine that this is a vagina, and you can insert it just a little ways and with it lubricated. And from there, it can be, you kind of want to angle it down instead of, up or straight in, kind of angle it down as you insert it. And it can be inserted all the way, or it can be inserted even just a little ways, depending on what you're feeling. From there, you can even work on the entrance, kind of going around the entrance and giving it just a little stretch. When you're starting out, maybe just 5 minutes or so that you want to spend working on these tissues. From there, you can angle it into other areas. So this is where this other model is going to come into play. I'd like to show you on this model how the dilator can be used to get into other areas, like into the side or even into deeper areas of the pelvic floor muscles. So here I have my model here, and I'm just going to tip it down so you can see those muscles inside. And I'm going to pick one of these larger ones here. So let's say we're using this dilator. This is number 5. This can be inserted into the vaginal opening, and then it can be like angled over into the side of the pelvic floor muscles, okay, or even, like I said, a little bit deeper in there to get other areas. So these are all pelvic floor muscles that fills this space and goes from the pubic bone back to the tailbone and side to side. So those are how dilators can be used. So a couple tips with the dilators. One is start with the size where you're going to feel a little bit of a stretch. You don't want it to be painful. You don't want it to feel like it's, really uncomfortable or that it's tearing anything by any means. So really you'd like to start with the size that's going to give you a little bit of a stretch and give you the ability to kind of work your way up. So like I said, there's 8 different sizes here, and you start with whatever size works and is given that little bit of a stretch, and then you can gradually build yourself up over time. So when you're starting out, you might want to keep your sessions to like 5 to 10 minutes. Give yourself some time in between those sessions as well. Meaning, like, maybe pick the same time like every day. Try to get it in most days of the week, because if you put too much time in between your sessions, those tissues are just going to go right back. So we want to think about it kind of like stretching out a rubber band. We don't want to do it all at once because that's going to be painful. We also need to keep with it and be consistent so that rubber band actually makes a change over time. So we want those tissues to lengthen out and accommodate, larger sizes. Okay, another tip is this can be done with or without a partner. It's totally up to you. It's your body on what you feel comfortable with. If you want to include a partner with this type of work, but it can totally be done by yourself as well. So that's personal preference, however you want to work. Another tip is using a dilator handle, which Intimate Rose makes for their products. So this is the handle here. It comes with these extra little pieces that fit onto the dilator and then onto the handle. So let me demonstrate that. So what you would do then is just insert this in, and then you have this bottom part that goes onto the handle. Give me a second while I struggle here. Okay, so this goes on like that. That way you can extend your reach, basically. So if you're really struggling with being able to angle this in or insert, kind of feel down and be successful, the handle might be an option for you as well. Okay, so that covers the dilators in a nutshell. I want to mention one other little product. This is called a pelvic wand, also made by Intimate Rose. It's a really great little tool as well. This one it's only one size. It's got 2 different ends. One is a little thinner. It can be used for rectal release, which is a whole other video, but this one here can be used for vaginal release. I have had patients intertwine them and use this side for vaginal release, so it's not like it can't be used that way. But the pelvic wand really can be inserted into the vaginal opening as well. And again, angled into areas here to get into the back parts or even the side wall of the vaginal space. So as we wrap up here, I just want to say this may be super intimidating to you. You might feel like, oh my gosh, I don't know where to begin, even with this short instruction that I gave you. You might feel really intimidated to think about your pelvic pain and how you can get to this point. And I get that. That's why I said at the beginning, in short, yes, it may be able to help with your pelvic pain, but this isn't necessarily the route that everybody goes, and it's certainly not the very first step to try. I actually recommend that you start with an assessment with a pelvic floor physical therapist, because we are in a position to help you learn more about your anatomy and those tension patterns that you may have in your pelvic floor, and really help you to proceed safely, and also give you a lot more direction on what needs to be addressed and what maybe doesn't. So I would recommend start with that consultation assessment with a pelvic floor physical therapist and get that information. So even when I work with my patients, this isn't where we start. It's a tool that can be used, but it's not the first thing that I go to. And I really like to teach my patients, to be honest, how they can do some manual release using their own finger or even their thumb into this area to get familiar with their own pelvic floor. And it really gives you a lot more sensitivity into the area, meaning, you're going to be able to feel with your finger or thumb if that muscle is tight and how hard or that you're pushing in there. With the dilators, it is a really good tool, but you lose some of that sensitivity when you insert, because then you're having to feel those tissues through what you're feeling on this silicone device. So again, it's not necessarily where I start, but it can be a good tool. If you are sitting here and you're wondering, if maybe I could help you as well, or if you have questions on your particular pelvic pain, please reach out to us. I'm happy to sit down with you for a discovery session, answer any questions that you have, and help you go to the next best step for you. You can head to our website, healingspotpt.com, and choose whatever option works out the best for you. Thank you for watching this Ed Talk.